I mean, it's work.
See, I'll tell you one
Like
thing.
they charge for 15 minutes. Why can't I charge for the work that I do? Yeah.
See, it's not just about the time.
Yeah.
It's not just about the time. See, n- people who are naive
Mm-hmm.
or just untrained, uneducated, or stupid about psychotherapy, I'm sorry to use the word stupid, but that's how it sounds to me. When people tell me
Okay.
that psychotherapy, if at all, it's extending a bit of time and a counselor should not charge, such counselors or mental health professionals themselves seem unintelligent to me.
Okay.
Because mental health professional, that is a psychiatrist is to patient ratio, doctor is to patient ratio, is anyways horrible in this country. Clinical psychologists per year, barely 1000 clinical psychologists are being, and I think 1000 clinical psychologists per year are passing out in India. That is also, I think I'm making an overstatement.
You're right.
So
A
when
lot
I'm
of them don't
sitting
even
in
practice.
So when I am sitting in a hospital, in a clinic with n number of patients and prescriptions literally raining out of out of the sky, it is not possible to sit and have a very disorganized approach towards psychotherapy and counseling. So we have to be on time because we are teaching somebody to be on time because we are trying to rehabilitate them. A lot of people, because of chronic mental health illnesses,
Mm-hmm.
they are not being able to organize their own time.
Correct.
We are teaching them time management. While we are doing cognitive rehabilitation, we are teaching them planning. We
You're
are
right.
retraining their executive functions. So if
You're
we
right.
don't know how to run the schedule on time, and if we don't know how to run things as per agenda of the session,
Mm-hmm.
then how are we any different from these so-called friends, or let's just say so-called other kind of leaders who
You're right.
barely just give some kind of baseless common sense talks over their podcast,
Right.
over their processions. Like, for example, there is a range. When we are doing exposure response prevention, there's a range of time
Mm-hmm.
where the anxiety is going to peak. We
You're
know
right.
that because as a behavioral scientist, we have measured it. Behavioral scientist implies clinical psychologist, experimental psychologist, applied psychologist, psychiatrists, neurologists,
Mm-hmm.
mental health professionals in our domain. We are working on data. This
You're
is the
right.
reason why we are giving, like, after 20 minutes,
Mm-hmm.
max to max by 40 minutes, when I'm giving exposure for
Mm-hmm.
any particular obsession or
Mm-hmm.
feared object, for phobia, the anxiety is going to peak in that particular time frame and then it is going to go down. So when I'm
Right.
giving that data, it is measured, no?
Yeah.
And after that, we are giving the client, we are also giving the time for them to reflect back.
Right.
We're also asking them questions. Earlier, you thought, how the protocol is. Earlier, you thought how
Mm-hmm.
you thought about yourself. Would you be able to handle at this point of time having faced the feared object, having faced your obsession? What do you think about yourselves and your strengths? Well, more or less
Mm-hmm.
close to these lines, these are the things we portray or we ask our clients, right? So everything
Right.
is timed. This is the reason why the kind of conversations that we are giving, they are scientific line of conversations. They are not some kind of Mansaram Bapu ki katha.
Right.
They are very different from what we say or do because everything is time managed. Also, we are teaching our clients how to manage your own time. This is the reason why we walk in a particular time frame. Now,
Right.
coming back to psychokinetics, there are
Mm-hmm.
certain classes of drugs that actually affect the learning center,
Okay.
as a result of which the capacity to take cognitive load is
Mm.
much lower. The threshold goes much lower. So, for a person to get mentally tired, it is
Mm-hmm.
much more easier for them to get mentally tired. So, this is the reason why a session has to have an agenda.
Mm.
Like up till these points, or these are the things that I am going to talk about or design an experiment. See, a psychotherapist, a clinical psychologist, any rehabilitation professional has an
Mm-hmm.
agenda for the session because we are designing the experiment with regard to that session. That means,
Right.
as a clinical psychologist, I'm designing an experience that the client is supposed to have just so that there is development of insight.
Okay.
This is the only reason why we are clinical psychologists and somebody is just a speaker. So I'm not a motivational speaker. I'm a clinical psychologist. I have agenda. I will teach you how to deal with your own issues, how to deal with your own self-defeating thoughts, how to
Mm-hmm.
deal and recognize your own self-defeating activities.
Right.
So it can be probably because of certain things we think, the quality of
Mm-hmm.
thoughts we have. Probably I am spending too much time on a particular narrative that is setting a tone
Mm-hmm.
of my mood, that is setting a tone of my neurotic tendencies, as a result
Okay.
of which, instead of being more solution focused,
Mm-hmm.
I am necessarily doing a behavior which is self defeating in nature. This
Okay.
is the reason why psychotherapist or a clinical psychologist will have a particular set time frame. So,
Mm-hmm.
to any individual who assumes that a client should or should not be charged, they should rethink, are they somebody who knows what we are going to do in therapy? The
Mm.
only time that I will disregard this protocol is when I'm trying to de escalate a patient,
Right.
specifically if they're suicidal in nature, if
Yeah.
I have had the identifiers. One of the sessions I'm going to teach you about suicide risk assessment.
Okay.
Okay, so in suicide risk assessment, again, there are identifiers: age range, gender, what is the kind of education and occupation, what is the access of certain things,
Okay.
or after what kind or nature of trauma we can expect in a particular age range, because of which we can identify the person is behaving likely in future they probably could self harm. So that is
Okay.
something
Got
I'll
it.
teach you in upcoming classes. Now, think about, if I am talking about client
Mm-hmm.
that behaves as if they already possess the desired skill or role,
Okay.
where I am targeting, um, basically, I'm teaching them to overcome the self limiting belief and increase
Okay.
the functional behavior.
Okay.
What kind of technique we going to call it? Do you think this will come under CBT, behavior